Another question, Benil Pillai, I think I'm saying that correctly. Benil, you asked about the spine. What can we do treatment-wise on the spine? Well, there have been podcasts, there have been webinars where I've spoken about this in quite a lot of detail, but that does not mean that you were present or have listened to the various different things or watched the different protocols. So in a nutshell, because this is quite a big piece, I'm going to try and give you, I don't know, 2 minutes, let's try, on the spine. So, what are we trying to do with the spine? If we're going to use the radial pressure wave, can we get deep enough to really affect the spine? Well, yes, that's what the 2014 Thomas Nedelka study discovered, is that radial pressure wave outshone short, medium and long term any kind of facet joint injection. That's been my favourite study for years. Tommy Nedelka, if you're out there watching this, honestly, just massive respect for doing that. Then subsequently, there has been a study, and I don't know if it's published yet or not, but I've seen it personally, which I'm very pleased about, which is replicating that study using the focus shockwave. And it's my understanding the results were better with the focus shockwave. And of course, they would be because they're able to work on bone tissue. So what were we doing with the radial beforehand then? Did the radial do some work on bone, or purely was it the soft tissues, the muscle, the ligament, tendons that were worked on which had the improvement? Maybe the disc. Could radial get deep enough for the disc? I'm not sure, and we can't prove anything about that. But for the facet joints themselves, certainly whatever was creating facet joint pain in that instance, those people were better off than if they had an injection into the facet joint. Therefore, we have to assume that radial either did something to the bone, or treating the soft tissues was superior to simply put an injection into the joint site. And that would make sense to me. So I feel that with the radial, you can work on the lumbar spine really effectively, but I think in my mind, we're dealing with the soft tissues. If you then bring in, either independently or together, the focus shockwave, I think then you're affecting the joint surfaces of those facet joints. And you may even be able to reach the disc. Now what it does to the disc or what, I don't know, but I have an enormous amount of success using EMTT, radial and focus on the lumbar spine. Now it does take time. I know some of you have these instant successes with shockwave where we're supposed to wait 3 months and within 3 weeks the person's feeling better. With the spine, I think you really are looking at the 2 to 3 month delayed result from that treatment. So tell your patients right out the gate, we're treating you now to be better a couple of months down the line, because that's collagen synthesis, that's protein synthesis, taking its 90 days to do its work. But I think that it is a phenomenal treatment for the spine. That we're talking lumbar. If you get into the thoracics and the cervical, I think we're really using radial. Yeah, I think there are people using focus on the cervical spine. I hope there's nobody using it on the thoracic spine. But they are having some benefits there. But you know, there's a whole load of things to think about in terms of contraindications. So on the lumbar spine, brilliant. If you haven't before, look up Thomas Nedelka's papers, read those, and I did a paid webinar on the spine, which went down really, really well. I actually got some extra work out of it in terms of doing some other, you know, kind of media type things around that, because it's obviously a big topic. If you would like me to do another spinal webinar as one of my free ones I've promised you, let's see if we can get likes and comments on this video, because I ain't going to do it if we just get 4 or 5 people going, yes, I need to see there's lots of people are going to get involved if we're going to do this as a free webinar. It's a big subject. Free, really would be giving away lots of info. So look, if you want it, let's make sure that lots and lots of people are vying for it. That wasn't 2 minutes. It was never going to be. You've met me before. We all knew that was going to be a lie. Okay, see you soon.